We're at the Farazi Clinic in Windsor Heights again, and Dr. Joe and I are going to continue our discussion about headaches. We're going to talk about the different kinds of headaches and how to treat them. Dr. Joe, last time you mentioned the word tension headache. Can you tell me a little bit about what a tension headache or a subluxation headache is?
Sure. Chiropractors use the word subluxation, and that just means sort of bone out of place, to make it simply. Tension type headache, most chiropractors believe are caused from subluxation. So that is something that would be a little different from your medical doctor. Your chiropractor, medical doctor might call it a tension headache. Chiropractor might call it a subluxation headache. But this is by far, in a way, the most common. We talked about more than 100 types of headaches. Well, 90% of them fall in the category of tension type headache. This is the headache that people get that starts at the base of the skull and sort of creeps up the back of the head. A lot of times starts in the neck. People then feel it sort of behind their eyes. It's a dull, achy headache.
Is it like pounding at all, or? Pounding
we associate a little more with migraine,
okay.
But again, any person can have symptoms. They don't have to read our books and come in with exactly the right symptoms.
Sure.
But this tends to be more of a steady, dull, achy type of headache. Again, far more common in women, about 3 to 1. People that work on computers for too long period of time, people that sit and read. And these headaches do respond to analgesics. Unlike migraines, where if you take Aleve, Advil, aspirin, the typical over-the-counter analgesics, it doesn't really help that much. These headaches respond. So it actually becomes one of the problems because people start to take these analgesics, or the NSAIDs as we call them, the non-steroidal anti-inflammatories, very, very regularly. And as I brought up in my very first show, those are dangerous drugs. So these are the headaches that'll start out episodic and then eventually become chronic, like we talked about in another session.
And how can you treat a tension headache?
Well, we first look at the cause.
Okay.
And the cause of these headaches, if we take a look at the spine, we realize the spinal cord is very, very deep inside you.
Okay.
Yet the nerves that go up the back of your head, they have to pass through a whole number of structures, ligaments, tendons, muscles. And when the vertebrae are out of place, a lot of these muscles will get very, very tight. And when they get tight, they irritate the nerves. And so a lot of the headaches, we believe, are caused by these subluxations or these joint malpositions in the neck. Another thing is that there are muscles in the neck that actually pull on the structure that surrounds your brain, called the meninges.
Okay.
And so if you tug on...
I've heard of those before, let me tell you.
Yeah, exactly. Well, that's where the term meningitis comes from.
Okay.
And everybody knows meningitis causes a terrible headache. Well, likewise, if you just pull on the meninges, you can also get the headache, but without the infection that we associate with meningitis. And so, as chiropractors, by moving these vertebrae in the upper part of the neck, we can typically help people. And by the way, we can help people, in my opinion, tremendously with these kind. This is one of my favorite things to treat. Because if a person has these kind of headaches, it's really changed their life.
Yes.
And if they've never been to a chiropractor before, typically by the time they're getting up off the table and checking out, they have a tremendous relief, if not the headache being gone. We see that very regularly.
Now, you said it's something that you like to treat. Is there anything you can do to prevent these kind of headaches?
Yes, absolutely. One of the things we do is take a look at your body mechanics.
Okay.
If you sit at work and your computer monitor is too low or too high, or your chair, so we call this the ergonomics of your workstation. But there's also ergonomics when you sleep.
Sure.
Are you sleeping on your side? Do you have too big of a pillow, too small of a pillow? Again, anything that...
Or about 10 pillows
yeah,
surrounding me.
Yeah, exactly. Also driving. Some people that sit in their car a long time have the seat a little too far back, and they move their head forward. So there's all kinds of things that we look at to avoid having them. And then we have other therapies like traction and ultrasound and electrical therapy and acupuncture, which we've talked about in a previous session as well.
Dr. Joe, is the treatment you do in your office special or different in any way than what another chiropractor would do?
You know, in most ways it's not. There's no special magic that happens in my office. Chiropractic treatment has been around, manipulation of the neck has been around for over 100 years. And the majority of chiropractors use those sort of manipulative techniques that we talked about in another session, where we sort of pop the vertebra.
Sure.
So almost any chiropractor that you go to, particularly with tension headaches or so forth, will probably get real similar results. And I would encourage people suffering from headaches to visit their chiropractor to get a diagnostic workup to make sure that it's not something more serious.
Sure.
But also, if it is one of these most common tension type headaches, I think they'll be very surprised at how much relief they can get.
That sounds great. Stop in and see Dr. Joe, or for more information, give him a call or visit his website, bearseclinic.com.